Welcome to this explainer. Look, if you're watching this, chances are you or someone you really love is going through the absolutely profound, literal, and physical shifts that happen to the body during pregnancy and postpartum. And let's be totally honest here, trying to figure out how to support all those changes, it can be incredibly confusing. So today, we're bringing you the ultimate masterclass on demystifying maternity and nursing bras. I am so excited to guide you through this because honestly, finding the right support is an absolute game changer for your comfort and your overall health.
Okay, let's dive right in. You might be sitting there in your first trimester, looking down and wondering, why does my regular, trusty bra suddenly hurt so much? If you feel like your standard bras are suddenly turning against you, leaving those awful red marks or making you want to just rip them off by noon, I really want to validate that immediate discomfort. It is completely normal. Your body is kicking off a massive physiological shift, and your pre-pregnancy wardrobe just isn't engineered to handle it. So here's our game plan for today. We're going to cover the maternal body's transformation, maternity versus nursing bras, your purchasing timeline, essential features and engineering, how to measure yourself, and finally, the perfect fit checklist.
All right, section 1, the maternal body's transformation. To really wrap our heads around why you need totally different bras, we have to look at the biomechanics of why your breasts are changing so rapidly right from the point of conception. Take a look at this number, 10 to 18. Thanks to a huge surge in hormones, increased blood flow, and fluid retention, each breast can add a staggering 10 to 18 ounces of weight during pregnancy and lactation. I mean, did you know that a lactating breast is actually about 33% heavier than a non-lactating breast of the exact same size? This mass increase places just unprecedented mechanical strain on your suspensory ligaments, which are called the Cooper's ligaments.
So beneath the surface, there are these rapid physiological micro-changes happening. Elevated hormones, like estrogen and prolactin, cause rapid glandular tissue expansion, which is known as lobulo-alveolar hyperplasia. And on top of all that, as your baby grows and diaphragmatic pressure rises, your intercostal rib cage can actually expand by up to 6 inches. Plus, your tissue just becomes incredibly sensitive. Your maternal body is this dynamic, moving landscape, which is exactly why stiff, standard bras simply aren't going to cut it anymore.
Moving right along to section 2, maternity versus nursing bras.
The terminology out there can be super confusing, so let's clear things up by looking at the functional differences between the two main categories of bras you're going to need on this journey. Maternity bras, those are your workhorses during the pregnancy growth phase. They focus really heavily on stretchable cups, breathability, and wide straps to accommodate that expanding rib cage and heavier breast tissue. Nursing bras, on the other hand, are specifically designed for the postpartum phase. They feature all that same great maternity comfort, but they are heavily engineered with drop-down clips, zippers, or crossover panels. Why? To allow for super easy, one-handed access when you are holding a hungry baby. Now, if you plan to breastfeed, you're really going to want to pay attention to the internal engineering of those nursing bras. Think about it. When you unclip the outer cup, you would lose literally all your support if it weren't for internal fabric architectures called slings. An A-frame sling creates a really supportive triangle around the breast, offering maximum hold. A side sling, well, that sits on the outer edge, pushing the breast forward and allowing for a bit more skin-to-skin contact with your baby. Both of these are brilliantly designed so you never lose structural integrity during a feed.
Okay, section 3, the purchasing timeline.
One of the biggest mistakes you can make is buying everything all at once. Your body is on a very specific chronological journey, so we need to map out exactly what to buy and exactly when to buy it. In trimester 1, so weeks 1 to 12, your breasts are highly sensitive and growing fast. Stick to soft, seamless, wire-free bralettes. Then in trimester 2, weeks 13 to 28, you'll want to invest in structured maternity bras. Now, here is the golden window, weeks 36 to 38. This is when you should purchase your first actual nursing bras for your hospital bag. For the first 6 weeks postpartum, rely strictly on wire-free transition bras while your milk supply is fluctuating wildly. Only after week 6, when your milk actually regulates, is it safe to get fitted for structured flexi-wire nursing bras. Trust me on this. What fits perfectly at 8 weeks will absolutely not fit at 38 weeks. Let's talk about what I like to call the hook rule. It is a vital strategy to make sure your bras actually last. If you're buying a maternity bra in trimester 2, make sure it fits you securely on the tightest hook. Why? Because your rib cage is going to expand as the baby grows, and you will absolutely need those extra rows of hooks to loosen the band over time. On the flip side, when you're buying your first nursing bras around weeks 36 to 38, make sure they fit perfectly on the loosest hook.
because after you give birth, your ribcage is going to slowly contract back down, and you'll need room to tighten the band as your body settles. It's such a simple trick, but it saves you so much money and frustration. This brings us to Section 4, Essential Features and Engineering. So when you're out there shopping, what non-negotiable features should you be looking for to protect your breast health? Well, here's your engineering checklist. Look for a bra with up to 6 rows of hook and eye closures for maximum band adjustment. You want wide, short-stretch shoulder straps to distribute that 33% extra weight and prevent serious shoulder strain. You also need stretchy top cups. This is so crucial because a nursing breast can fluctuate by 1 to 2 whole cup sizes in a single day, just depending on when you last fed. Finally, if you are opting for a wire later in postpartum, it must be a flexible wire with a wide smile shape that sits comfortably on the rib cage, never on the breast tissue itself. And that actually brings me to a very, very important warning. Rigid underwires are incredibly risky during pregnancy in those first 6 weeks postpartum. If a wire compresses a vulnerable, expanding milk duct, it can rapidly lead to painful blockages or even mastitis. It's just absolutely critical to stick to seamless, wire-free options during early postpartum. And under no circumstances should you ever sleep in a wired bra. Shifting around in your sleep can way too easily force the wire right into your breast tissue. All right, Section 5, how to measure yourself. Let's get into the real functional how-to of this masterclass with a totally foolproof sizing method that you can easily do at home. This is based on the modern direct underbust or +0 measuring method. First things first, grab a soft measuring tape and make sure you're wearing an unpadded bra, or honestly no bra at all. Step 1, wrap the tape snugly around your ribcage, directly under your breasts. Just breathe normally. If you get an odd number, round up to the nearest even number. That right there is your band size. Step 2, wrap the tape pretty loosely over the fullest part of your breasts, usually right across the nipples. Make sure to keep the tape level in the back. Step 3, simply subtract your band size from your bust measurement to find your calculated difference. Once you have that difference in inches, you just consult a standard chart. Actually, you might want to grab a quick screenshot right now so you can easily do the math yourself later. It's pretty straightforward. Every inch of difference equals 1 cup size. So, a 1-inch difference is an A cup, 2 inches is a B cup, 3 is a C, 4 is a D, 5 is a D, D, or E, and so on down the line. But remember, measuring frequently is key because, as we've seen, your size is absolutely going to change. Finally, we're at Section 6, the perfect fit checklist. Okay, you've done the math, you've ordered, and the bra has arrived. How do you troubleshoot the fit to make sure it is perfectly supporting your body? The crucial part here is knowing what a perfect fit actually feels like instead of just accepting the misery of riding bands and spilling cups. First, the center front of the bra should sit completely flat against your chest wall. The band actually provides 80% of the support, so it should be level around your back, and you should be able to slide exactly 2 fingers underneath it. No more, no less. Your breasts should be totally encased with 0 spilling. Always, always use the scoop and swoop technique, literally reaching in and scooping all your breast tissue forward into the cups. And if you are wearing a flexi wire, it has to frame the breast, like a picture frame, never ever touching the sensitive tissue itself. Now, when it comes to how many bras you actually need in your rotation, this number is your golden rule. 3. You need a bare minimum of 3 maternity or nursing bras. Why 3? Well, you need 1 to wear, 1 to wash, and 1 resting in your drawer. Because breast milk is a protein and your body temperature is elevated right now, you're going to need to wash these bras frequently to maintain their elasticity and fabric health. Plus, allowing a bra to simply rest for 24 hours between wears extends its lifespan significantly. Before we wrap up, I want to leave you with this incredibly empathetic reminder from one of our sources. You will likely have some days when everything feels tight. Please don't hate on your bra. Your body is making a baby, and this is normal. I love that. Your body is doing something just incredibly demanding. There are going to be days when you are swollen, sensitive, and flat out exhausted. Occasional discomfort doesn't mean you failed at finding the right fit. It just means it might be time to adjust your hooks, remeasure, or frankly just switch to a softer sleep bra for a few hours. Please give yourself some grace. And that brings us to the end of this explainer. So, armed with the sizing math, the proper purchasing timeline, and all the engineering features to look out for, are you ready to finally find the perfect fit for your body's amazing journey? I really hope this masterclass has left you feeling confident, educated, and fully ready to tackle your maternity bra shopping without all the usual frustration. You've totally got this, and your body is doing something amazing. Thanks so much for joining me today.